decision by tennis star Naomi Osaka to drop out of the French Open has raised questions about the mental health of athletes. Are they under too much pressure? How is it addressed? And what role does the press play? In my podcast, Voices for Change, I get answers from the experts.
The pressure that people put on you, along with the pressure that you put on yourself, it can break a person. The more the celebs come out of their shell and say something, I think more people will be comfortable to do so.
The language that people use to describe these things, it makes all the difference in the world. But it starts with speaking of it in terms that doesn't make somebody feel like something's wrong with them.
It's a big issue with many layers, and if you want to hear more of that, it's on my podcast right now, available on the News 5 app, Spotify, or Apple Podcasts. Osaka's story isn't the first professional athlete to bring awareness to mental health. Here in Cleveland, we know Cavs player Kevin Love is a big advocate for mental health, sharing his own experience with depression and anxiety. But what does this mean for younger athletes? Meg Shaw joins us now with more from one college player. Good morning, Meg.
Hey, good morning to you, Danita. You know, when you hear about high-profile star athletes like Kevin Love or Naomi Osaka talk about their struggles with mental health, it can make a big impact. But local athletes and the medical professionals who work with them say there is still more work to be done to break the stigma about mental health, especially with women in sports. Chelsea Penfield is heading into her junior year at Cleveland State University on the women's volleyball team. While she isn't faced with the same pressures as professional athletes, she understands the overall mental health pressures within athletics.
And I think it's just something that a lot of people my age and just athletes in general deal with, and they're not necessarily aware of it.
Chelsea says the pressure can cause anxiety before games and practices, or even affect her day-to-day life, especially when it comes to being a woman and body image.
You can't cry in front of your coach. You can't show emotion. You just need to be a machine, and we're not like that.
She finds talking with other athletes who have similar experiences helps.
If you allow yourself to be vulnerable, you'll find that others are likely willing to be vulnerable with you.
Cleveland State also offers a campus counseling center as well as a psychologist dedicated to sports teams. But she says more needs to be done to reduce the stigma of asking for help or expressing mental distress. For example, she says instead of pointing out an athlete is having a bad game, check in on how they're feeling emotionally.
It's really 90% mental and 10% physical.
Dr. Matthew Sacco, a health and sports performance psychologist at the Cleveland Clinic, agrees. He works with athletes of all ages, and he tells us stigma goes beyond just sports.
I admire a lot of the coaches and the administrators who do take this stuff seriously, because sometimes that's how it changes, when the people who are doing the work with the athletes and interfacing with them believe it. But we have a really long way to go.
So if you or someone you know is struggling with a mental health crisis, this is very important. The National Suicide Hotline is open 24 hours a day, 7 days a week. You can call that number at 1-800-273-TALK. You can also text 4HOPE to 741-741 for free support. We have these resources and many more right now on our News 5 app and news5cleveland.com/rebound. For News 5, I'm Meg Shaw.